very good afternoon to you from Bavaria. This is Corona Walks 21 and today I want to talk about failed systems. If you're bored with the media coverage of Meghan and Harry, then maybe this video is exactly what you need. Something different. I'm a professor of risk and crisis and I've been making these videos over the last 12 months, and they are videos that I shoot in the woods as I walk around like everyone else, locked down. And today I want to talk about a failed system. I've studied failed systems for most of my academic career, and it's always fascinated me, why do systems fail when they shouldn't, and why do systems succeed when they should fail? I've studied a number of disasters, and what's fascinating about most of these disasters is the way that people actually tried to do the very best they could under impossible situations, and they didn't fail, usually because of their decision making or because of their lack of gusto. They failed usually because of the conditions that they found themselves working in. They found that the system they were in was actually dysfunctional. And I've also looked at systems that have been successful, even though they should have failed. And what I found there was quite fascinating. It was usually that people were brave enough to actually question or even break the rules in order to bring about a positive outcome. So what is it that's happened in the UK in the British track and trace system, which has cost £37 billion, and yet it hasn't worked? Why hasn't it worked? Where has this money gone? And why has this money been spent on a system that has failed to track and trace? The government's own watchdog said that track and trace has failed to meet its original objectives. These are the words of the government's own watchdog. It's failed to track, it's failed to trace, it's failed to prevent the worst death rate of anywhere in Europe. More excess deaths in the last 12 months than since the Second World War. Some serious questions need to be asked. Now, track and trace is not solely responsible for this calamity, but it certainly deserves some form of public inquiry into why and how a system could be set up and be so dysfunctional. Let's put this into context. What exactly is £37 billion? Most people, when they hear a number like this from a politician on the TV, their eyes glaze over. Here we go again. We've put this much money into something. Well, let me just explain what £37 billion actually is. It's 37 and then you put 9 zeros after it. Let me put it into a different context. Think of the 1% pay rise that we've just given to nurses, which is frankly derisory and insulting. There's 187,000 people in the NHS, everybody from brain surgeons all the way through to whoever mops the floors. That's 187,000 people. If you divide 37 billion by 187,000, we could have given every single person who works in the NHS £200,000. Now compare that to a pay offer which is barely enough to buy a meal deal at the local supermarket or park for 90 minutes at the hospital car park. Now, I'm not going to say what a fair pay deal would be, and it's clearly a lot more than what they're currently being offered. And I'm not suggesting we give everybody in the NHS £200,000, although that's a lovely thought. Let's just compare what we've spent on this project compared with some other things that we spend money on. Secondary schools. This project has received more money than we have spent on the entire budget for secondary schools for the year. Nursery and infant schools. This project has cost more than the entire budget for nursery and infant schools. Public transport. This project has cost 10 times what we spend on public transport. This project has cost almost double what we spend on the police, the fire service and the prisons combined. This project has cost more than we spend on doctors, nurses, medicines, prescriptions and equipment in the NHS. This is not a small derisory amount. And the first question you have to ask is, who did we put in charge of this project and who did we ask to run it? Well, the obvious choice would have been, there is an organisation in the UK, it's been there for 70 years, it's called the NHS, National Health Service. It's there for a purpose, to look after the health of the population of the country, to prevent us getting ill and to help us when we do get ill. Why couldn't we have given them the project? No. We have to give this project to a bunch of private financiers and consultants and all the usual people who get the contracts when the government wants to dish out contracts over the last year. And they put in charge of it a woman called Dido Harding, who actually has a failed track record in virtually every project she's been involved in. Her husband, John Penrose, is the government guru for anti-corruption. So there's no danger of him calling any of this out as dodgy, because it's his own wife running it. And some of the big consultancy companies are there, charging £1,000 a day for supposedly giving advice. Some of the people who worked for the project claimed they were only actually working for 1% of the time they were paid. Some of them even left in disgust because they couldn't believe how the money was being wasted. And more recently, to try to make this look politically acceptable, they're now calling it the NHS Track and Trace, which is what it should have been from the very, very beginning. But it's still being run by the same private people. So when we looked at this project as a failed project, the first question we have to ask is, who's in charge of the project? Are they the kind of people who are capable of making rapid and quick decisions in a time of crisis and pulling a system out of a quagmire? We've heard the supporters of the government saying that these people had to make lots of difficult decisions in a short time period. But isn't that what they're supposed to be there for? Isn't that what a government are there for? We're not asking them to run a biscuit shop, we're asking them to run a country with 65 million people. Surely that's what they're paid to do. Maybe the reason this project has been such a failure is because the government were not really interested in this project. The government were much more interested in another project. And we know what that other project was. That was a project involving leaving the European Union, which used to cost us 9.4 billion, a quarter of what we've spent on this project. And look what we got for that 9.4 billion. And if we look at neighbouring countries in Europe, how is it that although their track and trace systems aren't very good, they're so much better than ours? And how is it that their track and trace systems are so much cheaper than ours? Is it because they work together in order to produce something that works? Is it because they acknowledge that people don't just stay in one country, that they move around and the disease moves around with them, and therefore we need a system to work together? Oh no, we decided we didn't want any of that from the very beginning. We told them that we are going to develop our own system. So when we start to look and pull apart this track and trace system that's been such an abysmal failure, we have to ask ourselves, did the government actually have their eye on this ball? This is the worst disaster of my entire career. More people have died in this awful pandemic in the UK than since the Second World War. More excess deaths than the Second World War. And we still haven't counted half the numbers. There's lots of people whose treatment for other kinds of problems has been delayed because our NHS system has been so starved of funds that we have something like an eighth of the number of doctors that they have in other countries like Germany. Something needs to be done. Track and trace hasn't worked. But track and trace is the tip of the iceberg. We really need to look at this dysfunctional system. This dysfunctional system that's run by a group of people who all went to the same school and all joined the same club at Oxford. I think this system is rotten, and I think that's where the problems lie. And we need a public inquiry for the sake of the hundreds of thousands of people who have died in this terrible pandemic. Thank you very much for your support if you've been watching these videos. I hope I've taken you away from whatever you were doing for 10 minutes and made you think. I look forward to your questions and comments, as always. And thank you for your patronage and watching me for 10 minutes of your precious time. Stay safe, look after yourself, and if you haven't had a mask, start wearing one. If you haven't had the jab, hopefully you'll get it soon. Or hopefully we'll soon see the end of this awful pandemic. Goodbye.